I'd like to move on to our first solo presentation. I'd like to, again, invite Ethan Che, co-CEO of Hippocrat, to give a speech on what Hippocrat is doing.
Hello everyone, it's me again. So I'm gonna introduce you about our protocol, Hippocrat. So our team at Hippocrat, we're building healthcare data protocol. What it means is that we help patients to own and manage their data using blockchain technology. So we spring out from the concept of data sovereignty, where our data has to belong to us, not like big tech companies or corporations. And around the world, new regulations are popping up to push this mandate forward, so that like whenever you go to hospitals or whenever you go to like healthcare services, they are actually obligated to give up their data to you. But we don't really have a standard format to do this. So we're building a data protocol that allows people to kind of control, own, and manage their data. I'm guessing a lot of you here travels a lot around the world. Who's like a digital nomad here? Anyone? Digital nomad, just one. I travel a lot for work and also for fun. And a lot of times, my concern is having a health problem somewhere outside my home country. It's not because, like, for example, if I'm traveling to Thailand, I don't eat anything raw in the tropical weather because I'm afraid of getting sick. It's not because the hospitals there are not that good. It's more about the language barrier, insurance policies, and also the fact that my health status is not shared and is not transferable across borders. And I had problems, like my fear comes from the fact that I grew up in Italy as a Korean immigrant, and I had problems with my knees growing up. So every time I had to go to the doctor, I had to do medical check once again in Italy and once in Korea and back and forth. And the only format I could transfer that data was in documents, and I had to translate it, and the images were given out in CDs. I don't think after 20 years it's any better now. A lot of the data produced in different healthcare institutions are not necessarily saved in a standardized format. And we still run in formats of documents, CDs, USBs, even though we're living in the digital world. So a lot of the healthcare data are fragmented and siloed from each other, and even among EMR companies, these data are not interchangeable or interoperable. We at Hippocrat, we believe that innovation is built upon data, and in order to do it, data has to be saved and processed in a standard format so that it could fuel other innovations from springing out from it, even AI. What we're envisioning to do here is that we're trying to build a world. We have a vision that anywhere you go, like in any part of the world, you should be able to walk into any hospitals or clinics and get a personalized healthcare, because they know exactly what kind of conditions you have, what kind of allergies you have, what are the diseases you had in the previous, when you're sick before, previous illnesses, just with a simple click of a button or just scan of a QR code. So we're building a data protocol that will allow you to do that any part of the world. So basically, this is how it happens. So we are building a data protocol and we receive data from various sources. PHR, which is personal healthcare records. In Korea, for example, is run by NHS, National Healthcare Service. So it's now open to public. It's not always the case in other countries. There's EMRs, electronic medical records. There are different companies servicing EMRs around the world, and they don't necessarily share data to each other. They don't even allow the transfer of data. There are a lot of regulations actually around how data is stored and how data is actually sent out from the EMR records. There are health sector results, And also, you have data coming in through wearables, like your lifestyle logs, your running logs, your monitoring of your blood pressure, etc. And there are also services like Noom, where you save your dietary plans and how you're eating, etc. What we're trying to do is we're gathering all that data through our protocol and saving on blockchain, so that you are the one who own it and manage it. So the way we do it is safe and private, because what we're getting is for example, this is how data is coming from the hospitals you're partnering with. So we have their personal data and medical data. Sorry about that. Mic was off. So we have personal data and medical data all jumbled up together when they're sent to us. So we have to actually detach each other from that. So we go through redaction, that's a typo. We go through redaction where we take out all the personal data away from the data we receive, and we replace the verification ID with the ID. And then we process the data so we can follow the HIPAA format, which is agreed upon standard for saving healthcare data and sharing with others. And we actually tag this data, label them, so that later when they're requested for trading or buying or sales, they know exactly what kind of data to find. So if they're looking for patients' data on diabetes patients, then they will be able to pick out which ones are the ones with the kind of conditions. And we embed factors so that this data could be easily fed into AI for further development of AI agents. So there's DID for the verification of who you are, so that we allow only you to access the data, and also rest is saved in a decentralized storage. That way, we can get the consent part of the data done through the DID, and then when insurance and R&D companies and pharmaceutical companies want to buy your data for profit, for you, for your benefit, we can actually share that without having to give out the personal data that can actually track back to you, which might give you disadvantages in certain ways. One unique part of how we process the data is that when we receive the data on our server, we don't actually see it. So we create a contained environment where all this processing happens, and then data is saved directly to the IPFS or decentralized storage connected to a DID. Unlike centralized server, when this process happens, the admin can have access to all kind of data within the server. We don't do that. So there's more privacy to it. And our partners, usually hospitals and medical institutions in Korea and outside Korea, they don't like to deal with blockchain. They don't like to deal with crypto because of a lot of reasons, regulations, policies, etc. So we made it very simple. They just have to implement our API, integrate it, and the rest is done by us. And there will be the end user who will be using that data, transfers, downloads, uploads, etc. But they also don't need to know about blockchain. That's what we're trying to do here. The way we save data is very safe, because the way centralized servers work is that if you breach into it, then you have access to everything inside. Here, we're basically building a private safe, data safe for everyone. So if you want to hack into millions of patient data in our protocol, you have to hack a million times. And also it's private and selective in the sense that before, if you look into the, not a lot of people have access to how data looks in EMR records, but it's jumbled up with your private information and also your healthcare data. We detach each of them, but we save in different storages, so that only the necessary information will be given out to legal parties. We use Korea as a testbed. We are probably finished the integration with most of the major hospitals that we are working with within this year, and we are collecting data. Well, we don't collect it, we help people manage the data on blockchain. And this is Korea is a very interesting market, an interesting place because we are most digital out of the world in terms of EMR adaptation. We have 92% of adaptation rate, and compared to other advanced countries, which is 84%, compared to US, which is 60%, we have most of our data on digital format. And like NHS in Korea, they boast about 3.4 trillion data points already. So, and another unique thing about Korea is that our government kind of mandates us to do annual or biannual health check. So we have a largest set of time series data on a person's health status over the years. We are working with major hospitals in Korea, 2 of the top 5 hospitals in Korea, and also with Southcare, which is the biggest health check company in Korea. They have 8 centers around Korea, and they do 1.5 million patients a year. And they have accumulated unique patient number of 4 million people. And we're onboarding that data within this quarter. And then that data will be renewed every year. About 1.5 million people come back to get a health check. So this will be a huge amount of data. I think we have the most sizable amount of data records on blockchain, or even outside blockchain in the world after the integration. We're addressing a very fastly growing market of data analytics, healthcare data analytics. It's growing at a rate of 20% in a year. I'm not going to touch a lot on this. So what our mission here in Hippocrat is we're trying to build a data layer, data protocol that gathers all this fragmented data from different sources and process them in standardized ways so that we enable innovation on top of it, such as personalized healthcare and monitoring, constant monitoring of your life log data, and also even sales and trading of your data for R&Ds like pharmaceutical companies. Like it seems like a lot of data is sold and traded, but it's not. There are only like 1 or 2 B2B cases of 23andMe selling data to like big pharmaceutical companies, but that's like one-time deal. There's no open marketplace for healthcare data. So we want to enable that to happen. And it's very hard for AI companies to build healthcare-focused AI because not a lot of the EMR and PHR records and diagnosis and prognosis is available for these AI companies to pick up. So we want to be the provider of data for AI development in the future. So this is the vision we're envisioning, and I believe that our team is stepping closer to it every day. Thank you for listening.
Thanks so much, Keith, for such a great speech.